Good afternoon, folks. This is Judge Executive Al Mattingly bringing you our weekly COVID update. Today I've got a old timer with us. He usually appears with Dr. Dufresne, but we thought Dr. Dufresne likes to talk a lot, doesn't he, Clay? So we thought that we could get a lot more information out of Clay by just having him on here. And really, that's not true. Dr. Dufresne does a heck of a job for Owensboro Health, and has always been gracious and courteous when it comes to his time. As always, I would like to start, even though I'm in my office by myself, and so is Clay, I like to start wearing my mask because that's the number one weapon that we have against the spread of COVID in our arsenal. Wearing masks, socially distancing, sanitizing our hands. I don't hear so much about it anymore, but avoiding large crowds is still as important today as it has been in the past. And we have another weapon to add to that arsenal, to those 4 bullets, and the 5th bullet now are the vaccines. And we're going to get into that in a little bit. I just want to give you a little bit of an update on what's going on in Daviess County. So I get over to the sheet, and Clay sends these to me every day, so he's going to have to bear with us. Talking about the Green River District, there were 25 additional COVID cases reported today, 8 of those in Daviess County. That's down from about 26 yesterday. If you look on the screen right now, we've got it. There's 9,708 confirmed cases that have been reported, 8,805 recovered cases, 160 deaths. And if you will, just let's take a moment of silence to remember those folks that we've lost to this pandemic. Thank you. The good news is, if there is such a thing as good news, I don't believe we had a death in Daviess County, Clay, for a week, maybe somewhere around there. Just nod your head, yes, no.
Yeah, the deaths have slowed down substantially, so that's great news.
So if you take the recovered cases from the confirmed cases minus the total deaths, we've got 743 active cases in Daviess County. As we've heard Clay talk about before, and you've heard me say, if we've got 743 active cases that have been diagnosed, we probably have 4 or 5 times that many cases that are out there for people who just think they have a little cold or flu or whatever. So on the 8 cases today, let's look, Jordan, at the state map just quickly. I think the state map, this will be based on the 16th, so it doesn't have today in. You'll notice that Daviess County averages 12 cases per 100,000, so we are in the orange. One of the really, along with Ohio counties at 16.7, we're 2 counties in the GRAD or Green River District health region that's still in the orange. Notice Union County up there with 0 cases. I suspect they have less than 1, and that puts them into the green. One of the things that you have to be very careful about when you're looking at these things, they're all based on populations per 100,000. Cases per 100,000, and that's a 7-day average. So Union County might only have 5 or 6 cases tomorrow, and they would go back in the yellow, but that's possibly enough to get them up into the orange. It doesn't take on counties that have small populations, doesn't take a lot of cases to change. Look at Lyon County, the last red county to your left, 788 cases per 100,000. That's where I think our Kentucky State Penitentiary is located. They've had a pretty serious outbreak there. I like to compare Daviess County to the average across the state, and Daviess County right now at 12 is lower than the state's 13.3 average. So I think Daviess County is in the right direction, going in the right direction. Doesn't mean that we can relax our guard, doesn't mean that we can not wear a mask or that we shouldn't be sanitizing our hands or avoiding crowds outside of our immediate family, but it means that we're on the right direction. Part of that has to do with the vaccine, and that's what I'm really interested in talking to Clay about, and hope that you guys, if you have any questions, just type them into the chat box and they'll get them to us. One of the things that I wanted to mention today is the average age of the cases. Average age is 44 years old. Now, that includes cases as young as 1 month old and as old as 102 years. So anybody that says that you can't get COVID because you're this age or that age, this just disproves that. The vast majority of the cases are occurring in that 20 to 49 age group. 20 to 29 is 3362, 30 to 39 is 3229, 40 to 49, 3189. So let's go to that next slide that you have for us. There are all kinds of folks who are providing vaccines. You can go to Vaccine Finder. One of the best places to go, I think, is the Kentucky COVID-19.ky.gov, that site. And then if you go through that site, you'll see view vaccine information. There's a COVID hotline where you can call to get questions answered. You can see a copy of the map that we just put up. So get on the internet and use what the government has put out there. Another great place to go is the Green River District Health Department. And what is that site, Clay? Healthdepartment.gov?
Healthdepartment.org.
Healthdepartment.org. You know, it must be an old site to have been able to pick that name out. So
we got very fortunate to get that web address.
And lastly, I would tell you, if you need information, come to our Facebook page, to our web page. Jordan, see if you can put the flyer up. There we go. The flyer that we've developed, and it talks about COVID-19 vaccine. It kind of tells you everyone who qualifies for the vaccine and wants the vaccine should get a vaccine. If you don't have a car, you don't have a computer, it's no problem. This gives you some phone numbers to call, some places to access. It talks about individuals, and it also talks about organizations who might come up with a group of folks that they would like to have vaccinated. They can talk to the health department. The health department can tell them how to do it, where to go, when to get it done. I think I saw Clay where you guys went out to Owensboro Regional Recovery, I think the other day, and vaccinated right there on the site. You sent people, went on site. I think they got to Johnson & Johnson. I thought the comments that you made was it's kind of a transient population. So it's sometimes you don't know if they'll be around when it's time to get that second shot. So with that information, I'm gonna close her down, Jordan, and get it back to just Clay and myself. There we go. Clay, I want to welcome you, and I'm going to give you a few minutes to say anything that you would like to say, bring us up to date on perhaps the number of vaccines that have gone on in Daviess County or in our area. And I know that's a difficult number to come up with because we have a lot of people coming from surrounding counties into Daviess County. So we don't know that, but we have to assume that there are some Daviess County folks who are going into the surrounding counties. And I know that happens. So Clay Horton, Director of the Green River District Health Department, welcome and talk to us a little bit.
Thank you, Judge. I always appreciate this opportunity to chat with you. Things are moving in the right direction. Where our cases are steadily declining, and as you went over, and we were in that red category for quite a long time. So even though we haven't quite got to the yellow, we've gotten close a couple of times. We will get there if everyone keeps doing what they're doing. And really the thanks needs to go in large part to the community. The reason our numbers are coming down, or a big part of the reason our numbers are coming down, is because people are doing the things that we've been advising them to do, wearing their mask when they're around other people, trying to watch their contacts outside of their household. And most importantly, we have a lot of people that are seeking and getting vaccinated. And we need everyone to continue with that. vaccination, the demand, I guess, is still high, but we are noticing it lessening some. So there are vaccines in our community, and if you're eligible, certainly go get vaccinated. And there's lots of different providers within the county that are doing that. So you'd asked about numbers of vaccines, and my numbers are actually a couple of days old. I think these are from Monday. But in Daviess County so far, as of Monday, we had all providers combined that had reported had administered 54,893 doses. And so that's obviously by the location of the providers, not necessarily the location of the residents. The state has been working on a report. There are multiple data systems that you have to pull this from, but that they are looking at trying to start reporting out by zip code of residents, so that we'll get a good idea if we have places in the state or areas in the state where we have disparities in terms of vaccine distribution. But of those 54,000 vaccines, let's see, those were doses. 36,433 were unique individuals or first doses. So some of those are Johnson & Johnson vaccines. About 400 of those were Johnson & Johnson vaccines. So those 400, they're fully vaccinated at this point, or if it's been 2 weeks. And the others, we're going to assume that either 3 or 4 weeks later, depending on if it's Pfizer or Moderna, they're going to be receiving their booster shot. So vaccinations are going well. Our processes are working well. I get good feedback from people that are using our site, that are using the hospital sites, that are using some of the retail pharmacy locations. It's kind of fun to go to these vaccine clinic days because people are happy. They're happy to get that vaccine, and the tagline they've been using is "Shot of Hope," and that's I think that really kind of sums it up. And the number of vaccines that we're seeing doled out is also contributing to our declining numbers. So getting back to some semblance of normal is not going to be a binary change. It's not going to be in COVID on Wednesday and on Thursday everything will be normal again. But we're making progress and we're moving in the right direction.
Clay, early on, we were seeing large outbreaks in meat processing, factories, things like that, and nursing homes as well. Have we seen that cool down, calm down some? And a second question to follow up with the nursing homes, I would think that with the ones who wanted the vaccine, getting the vaccine, that should have helped there. I think that's one of the reasons probably we're seeing fewer deaths being reported now. We have fewer older folks ending up with complications in the hospital.
Yeah, so the big outbreaks that we saw with the meat industry really had calmed down early summer last year. So that primarily had to do with the practices that they put into place and the safety precautions that they were able to institute. So we will still see clusters here and there. We'll see them associated with workplaces or churches or other places where people get together and socialize. The nursing home outbreaks have drastically gone down. At one point, we had 2 contact tracers that were exclusively assigned to tracking nursing home cases. We've had to reassign them. There's not that much work to do, and that's a good thing. And then talking about the vaccines, there was a really good article in the Herald Leader this morning about an outbreak in a nursing home in Eastern Kentucky. And you may even heard it mentioned on the governor's press conference yesterday. They had talked about it was a particular variant. It's not one of the variants that we hear a lot about. But in that nursing home, I think 80 some odd percentage of the residents had been vaccinated and 40% of the staff had been vaccinated. But there were vast differences between vaccinated and unvaccinated folks in terms of symptoms and their outcomes. So I think 5 people were hospitalized. One of those had been vaccinated, but the other 4 had not been. And of those that had been vaccinated, most of them did not have symptoms or had very, very mild symptoms.
Well, if you recall, that's the message we've been trying to get out to people that just like flu vaccines, you may be vaccinated, but you still could get the flu, but the fact that you're vaccinated may mitigate the symptoms, your body's responses, so that you end up not in the hospital, you end up not dying. You may not spend a few days in bed, but other than that, it's a lot better than where a lot of those folks have ended up prior to the vaccine being more widely. And you talked about a variant. What variant was that? Do you recall?
Well, they haven't identified it yet.
Okay.
But what they do know is that they're all linked together because of the genetic sequencing that they've done. So there's probably going to be some more analysis that needs to be done. But they did rule out that it's not the British or the South African variant or any of these ones that we're hearing.
I was thinking there was one that I'd heard of that came from the West Coast, but I'm not sure. But just for the folks who are watching, all we're saying, all a variant is, it's not a boogeyman, not a boogie bear, but it's the COVID-19 virus that has mutated, has changed just slightly. And what they've been seeing, Clay, and that leads up to this question about how concerned you are about the new variant found in Eastern Kentucky. I think you answered it, that if we do the things that we normally do and we get vaccinated, while we still may get it, we're going to be protected from the more serious consequences. But yeah, variants happen. They happen all the time. They happen in nature. That's typically what happens is you've got a benign virus that makes a jump somehow, some way from an animal into a human. And really a lot of times the variants or the mutations, it goes from a very virulent to a less virulent, which is what we like to see. I think what we're finding in a lot of these COVID variants, though, they're more infectious, meaning they spread easier from person to person.
Right. And I think, and of course, the variant's is a hot word now, and I think it causes a lot of anxiety with folks. But really, the take home message from the story this morning, and I was glad that the Herald Leader got this, was that the vaccines are working and they're helping. And I think that's the important thing that we need to highlight from that experience.
Right. We've got that answer. Our cases have been trending down. I think you're right. I think Daviess Countyans have done a good job. Well, I still see people on Facebook talking about people who have their mask down below their nose, or they're not wearing masks, or they're doing those things. I have to confess, a lot of places I go, people are masked up. They're wearing them properly, and they're standing their proper distances, and employees, servers are wearing their mask. But let's then talk about the vaccine. How much of an effect on our drop in cases do you think the vaccine has had? A huge effect, a negligible effect, or it's an effect that you really can't calculate?
I don't think that we can quite calculate it, but what we know is that there's several things that are pushing us in the right direction. We had this huge surge in the winter, through December and January. And so, we've got a lot of folks in the community that probably have some natural immunity. We've got a lot of people that have gotten vaccinated. We've adapted, and our collective behaviors have improved. So all of those things are contributing to it. Now we're still dropping. We're not dropping as fast as we have been for the last 4 or 5 weeks. So we've seen that nationally. We're seeing that at the state. Daviess County and the Green River District Health Department, we peaked a little higher than the state of Kentucky did. And we came down a little slower at first, but we've passed, as you showed on your map, we're now below the state rate. But it is leveling off, and if we can kind of keep moving in the same direction we were and drive it down a little bit lower, that's going to put our community in a lot better place.
One of the, I don't say problems, but one of the issues, and you hold on just a second. That's the engineer, and I'm going to tell him I'm not going to talk to him. It's harder to drive averages down and up in counties with large populations than it is in counties with small populations. And that's what I talk a little bit about this, because I know we reported 0 cases Monday, and everybody was, I could hear a collective sigh of relief. We're home. Well, then yesterday we report 26 cases. So you've got to understand that particularly on weekends, things are slow. There's maybe less testing, slower reporting. And that Monday, probably of all the numbers we get, the one that's most unreliable or the least accurate is that number we get on Monday.
Yeah, on any given week, that's true. Now, some weekends it seems like the reporting never slows down, but there are certain weekends. I don't know if it's the way shifts are set up at different healthcare providers, but you can tell that we haven't heard from people that we normally hear from, and so that will cause some low numbers on Monday. So I think that the most effective way to gauge the risk in the community, we report these numbers daily because there's a demand to know that. But probably the thing to watch the closest is the map at covid19.ky.gov. They're looking at a 7-day average of that incident rate, and that's where you're going to be able to get your take-home message as to terms of what is circulating in the community and what is the risk. So
now we hear at fiscal court, and I know there are some folks out there who keep their own set of numbers and statistics. We do a daily running total based on what you report, because there are always, and we've said it from the beginning, March a year ago to present, there is always a difference, a slight difference between what the state reports and what is reported here. So a lot of times there might be a lag in that reporting, but in the end it catches up. And I go to the state seems to have it reported by 5 p.m. our time every day, and that's when I get on the computer and go look. So two questions. You saw the article about one of our colleges that had an outbreak or tended to have an outbreak. Wasn't a large number of students, I don't think. And I don't know that you want to give us that info, so I'm not going to. But when we talk about the college, brings to mind what's going to be happening the next 4 weeks. That's called spring break. How will that affect our numbers? What can we do to, and I know it's difficult, old people like me, I drink a beer, I sit in my easy chair and I go to sleep. Young people drink a beer and then they want another one and then another one. They want to go dance and carry on, and just like I used to, just like you used to. But we need somehow to send out the message to those young folks who are leaving Kentucky, who's done a really good job in controlling what's going on, and they're going to go into states that have pretty much opened up. And when they come back, they may end up bringing that illness back to some of their loved ones or some of the other students. So tell me a little bit, what do you think is going to happen there, and what do we do to get that message out?
Well, we're trying. We're concerned about it as well. And as you can, if you're following the national news, I think a lot of people are concerned about it. You see these stories of big crowds in places like Florida where people aren't wearing masks, and there's potential risk there. And we talked about the surge in cases that we saw through January. I mean, that was a direct result of people traveling and getting together in Christmas, and we still run that risk. We're starting from a little bit lower place this time. We've got a lot more people in the community that have some immunity. So we hope that it'll be slower, but it's something that I'm concerned about. It's something that I think that everybody should be concerned about. And like I said earlier, we're headed in the right direction, but it's not over yet.
Right.
And I think that, I think one of the challenges that we have at the health department is, as we move into the summer and as we start seeing lower and lower numbers, how do we effectively communicate to people that you still need to be cautious, but we are making progress, and how do we unwind a lot of these, how we've advised people and these the guidance that we've given over the last several months. How do we start? Jordan had sent me some of the questions, and one of them was, can we have a wedding in the fall? probably can. I don't know what that's going to look like yet. And, you know, as we've got to figure some of that out. And it may be a little early to figure that out, but I think we're certainly heading in that right direction. So what I would say to people that are planning the spring break and is, you know, we're almost there. Think about spring break next year as looking more like it used to. This year, it needs to look a little different. We still need to be cautious. We still need to avoid large crowds, and we still need to be wearing masks when we're around people that are not, you know, not in our household and not around others that may not be vaccinated. So that's, you know, CDC released some good guidance a couple of weeks ago. That's now saying it's okay to get together with other people that have been vaccinated, or maybe getting together if some people are vaccinated, even getting together with someone else from another household that's unvaccinated, as long as they're not at high risk. So, you know, we're gradually getting there. So it's not the same place that we were in this time last year. So.
You know, it's funny. I was talking to a friend of mine. He and his wife, my wife and I, and a couple other people get together. We take an annual trip about this time of year. The last time we took that trip was last year in early March. And by the time we got back from that trip, COVID had gone full blown. And we have canceled several trips, this group. And we've talked, we didn't do it this month. We're talking about perhaps looking in September, October of this fall, just to see where things are going. But that brings us to another question that we received. Is it safe to travel now? Trying to decide about summer vacation plans. And I think you answered a good portion of it. Is it safe to travel? I mean, wear your mask, sanitize, you know, keep your distances if you can. And wherever you go, you certainly, you can't be safe traveling. And then when you end up at your destination, end up in a crowd of 1,000 people, shoulder to shoulder.
Right. Well, it's probably not popular to say, but I mean, I think the CDC's recommendation still is to avoid non-essential travel. So if you have to travel for medical needs or, you know, to help a family member or something or for work, that's certainly, you know, something that you have to do. But if it's something that you can postpone, that's still probably the safest play.
You know, go back to weddings and big crowds. My wife and I attended a wedding back in January, and we sat as far away in a corner of the church as we could, and we didn't go to the reception. I mean, that's a choice we made because we are seniors and we run a greater risk than a lot of those young folks. And the young folks, they may catch COVID and have mild symptoms, but they can pass it on to mom and dad, grandma and grandpa, and really cause an issue. Contact tracing, you talked about it a minute ago. Where is the health department still doing contact tracing? Is there a lot of it still going on? And is it still important, or is it something we just forget?
Well, we are still doing it. In fact, we're doing more of it now than we had been, you know, back through November, December, and January, because the cases are at a manageable level now. So, you know, for a while there, we were contacting just the positive cases and any high risk, you know, very high risk contacts. We've gone back to the more optimal mode where if we find out about someone as a close contact, we have one of our contact tracers reach out and talk to that person directly as well. So I think, you know, as a society get a handle on this, you know, contact tracing will look probably a little different. Right now, I think it's still important. It's still a good step in terms of providing people with education and helping, you know, kind of knock down the spread within the community to make sure people can stay at home until they're no longer infectious, or stay at home if they run the risk of becoming infectious. But I don't know exactly what that'll look like a year from now. I think that COVID will be something that we still have to pay attention to. It's something that we'll have to monitor, but it's not going to look like it has for the last year or so. But for the short term, we're still doing it. I think it still is an important step. Once we have, you know, the majority of society vaccinated, and we don't see it the potential for rapid spread like we have now, it probably won't play as an important a role as it has for these last 12 months.
Well, I think it's important to let the viewers know and the people who might see this eventually that COVID is here and COVID's here to stay. It's just like the common cold, just like the flu. I mean, it's what we don't know right now is how much protection does the vaccine give? Do we need boosters? And you know, we talk about the mutations that occur and change things. Those same mutations occur with cold viruses and flu viruses and any kind of virus. And really it happens more rapidly because folks don't understand how many generations of cell division go on, or with viruses, it's not even a cell. I mean, they're actually using your cells to make more of them. That's the Trojan horse that viruses have. But one of the things I wanted to make mention was contact tracing back in June. Very responsive, very quick. Friend of ours had tested positive a day. Within 24 hours of him getting his positive test, we were called and told that we were in contact. I know in December and January, I think in some cases, if a person tested positive, we asked them, call the people that you've been around and tell them you tested positive, because quite frankly, didn't have enough contact tracers, probably didn't have enough phone lines. So, but one of the things, what I wanted to tell people is, and they believe that contact tracing is all a result of COVID. No, just the numbers of contact tracers are. All we're talking about are detectives. And if there is an outbreak or if there's a communicable disease, we've been doing contact tracing for years and years and years, haven't we?
We have, yeah. We of course, we had about 7 nurses that did most of our contact tracing, and 1 epidemiologist. And those nurses had lots of other duties, you know, that was something they might do a few hours a week. So with COVID-19, it was really just the scale that was different.
Right.
We continue to do contact tracing on a lot of infectious diseases, tuberculosis.
Yeah.
That we still spend a lot of time in.
Well, and let's, you know, STDs, things that can get out into, I mean, if you have an HIV outbreak, you're trying to find out who, how, when, what, and where. You know, if measles outbreak, chickenpox, all those kinds of things, we've been doing that, or the health department has been doing that for years and years and years. And it helps us control the spread of that disease. So I thought it important for people to know that, because in the society we have today, they just know that contact tracers are probably from the FBI and they're checking on what they do and where they're at. Let's see. Oh, here we are. Just announced on ROMP Facebook page. ROMP's scheduled for September 15th and 18th at Yellow Creek. Yep, I heard that this morning, and I would tell you that that's a tentative date. It's like most dates for these things. I believe that those folks, have they been in contact with you, Clay?
Yes, I've talked to the folks at the Museum Hall or the Bluegrass Hall of Fame, and they're looking at a lot of different models. And like I said earlier on the question about can we have a wedding in the fall? Mm-hmm. And the answer is probably you can. And we're not sure exactly what things are going to look like. And from my take from the Hall of Fame is that they're committed to doing it safely, and they may not be able to tell you today exactly what everything is going to look like, but it's important for them to get a date on the calendar and have a target to work towards.
Good thing about ROMP at Yellow Creek Park, there's a lot of space. The space is outdoors. The bad thing is you have large crowds sitting shoulder to shoulder. So it's you know, it's the best of times and the worst of times. So.
And hopefully it'll be quite a bit different, you know, especially if at that point we're still concerned about COVID. So,
okay, Clay, just for the people who are watching and for my own edification, when do I need to quarantine now? Things have changed. It seems like when do I need to quarantine? For how long? Can I shorten that quarantine by having a PCR COVID test? How reliable are the rapid tests versus PCR? All those things that we preached early in this outbreak, simply because we didn't know enough about the other stuff to talk about it. So let's review some of that old stuff.
Yeah, so it evolves, right? Because we have more knowledge now, and then we also have different factors that we have to take into consideration. So I'll just start with the basic. If you had contact with someone who was positive for COVID-19, and it was during that period of time where they were shedding the virus, which would mean like when they had symptoms or a couple of days before, we would recommend still to this day that you quarantine for 14 days. And what that simply means is you stay away from other people. You stay home and stay away from other people in case you get sick, so you don't take the chance on infecting anyone else. Now, there are some options to shorten that. You mentioned getting tested. There's the CDC has got really strong data on, if at the day 10, if you haven't developed symptoms yet, you're probably not going to. There's a slight chance that you will. So if you could shorten that quarantine to 10 days, if the setting that, if your work setting approves of that or your school setting approves of that. Still have to monitor for symptoms for the full 14. If you test after day 5 and that test is negative, and you still don't have symptoms at day 7, then you could also consider shortening that quarantine. And the latest change is that if you're fully vaccinated. So if you have been vaccinated from COVID-19, and when we say fully vaccinated, that means 2 weeks after you completed the series. So in the case of Pfizer and Moderna, 2 weeks after you got the second dose. In the case of Johnson & Johnson, 2 weeks after you got the shot, you would be considered fully vaccinated. In that scenario, if you were around someone with COVID-19, you don't have to quarantine. If you don't work like in a jail or a nursing home or a group home or someplace, like that. Those folks at those high-risk settings, we would still advise to quarantine. So we get a lot of these ifs and these qualifiers, the more knowledge that we have. But that should encourage people to get vaccinated. Now, we still want you to monitor for symptoms. If you become symptomatic, you need to isolate immediately, get tested just like everybody else. But as we have more and more people in society that are vaccinated, we're going to have to require fewer people to be quarantined.
Let me tell you a personal story. My wife and I both had both our shots, Moderna. It was 3 weeks after we had the shot. I was exposed to someone who had COVID. That person ended up in the hospital for 2 weeks. Really, it was touch and go. 2 other people who were with this person ended up with COVID themselves. I had no COVID. Now, while I was with this group, I had my mask on and I stayed as far away as I could, not knowing that he had COVID. I can't emphasize how important it is for folks to get vaccinated. Now we have three choices now. Actually, let me back that up. We shouldn't consider them choices. The first vaccine that becomes available, we take.
That's what we would recommend. Yeah, they're all good vaccines. There are slight differences in some of the data. A lot of that's just because you run a trial or you run an experiment. It's going to vary. Your results are going to vary just a little bit each time, but they're all effective and they all do their intended purpose, which is prevent severe illness and prevent ultimately what we care about is people not dying, and they're all very effective at that.
So if it came down and someone was saying, well, I'm waiting for X, you would say, well, if Y and Z become available, you take one of those and you are going to get as good protection with them as you would with the other from dying or ending up in the hospital.
Yeah, so I think probably the risk of delaying vaccination probably outweighs any small differences that you're going to see between the different technologies that are out there. So, we've had a lot of requests here in the last couple of weeks for Johnson & Johnson vaccine, and we've used some Johnson & Johnson vaccine, but we're getting people on our waiting list and we call it a schedule them, and they want to know what vaccine we're offering, and if we have Moderna, that they want to wait. And so, I don't advise that, but as supply continues to increase, there's going to be options there. If you, but my advice is to take the first one that you're offered.
And let's be clear, the weight is strictly a function of supply. There's just not enough vaccine out there to go around. Although I did hear you say, and I'll reiterate it, that seems the demand seems to be slowing down some. I hope that's not because of COVID or the vaccine reluctance, as we talk about it, because anecdotally, as I just told or showed you, getting vaccinated can protect you when others are not as protected. I think the nursing home story up in Eastern Kentucky is another illustration of that. So, do you expect a fourth vaccine? I know AstraZeneca has been in the news lately as some issues have occurred, but I think all the governments have said they don't believe that the blood clots were associated with the vaccine. Do you believe a fourth vaccine will become available in the United States?
I would think so. I mean, I think there are several others that are still in the pipeline. AstraZeneca is one. There's Novavax is one that I've heard some about. Sanofi has a vaccine. Was it GSK? Was that GlaxoSmithKline? There are several that are in the pipeline. So I don't have any information about when they'll be available or what status those trials are in. But yes, I think you'll continue to see people developing COVID-19 vaccines, and that's a good thing.
Right. Do you think eventually we would get, as someone who's over 70, when I get my flu shot, my annual flu shot, I always tell them that I need the old people's flu shot, which is an extra strength, or I guess I don't know what the difference is. Do you think that we will get to that point where there might be a difference in the strength or the dose in the shot based on age?
Yeah, you're probably asking the wrong guy, but maybe, yeah. There is a high dose flu which they recommend for people over
Right.
65, I think, or maybe it's 60. But there are some. The AstraZeneca is one that it's a 2-shot series, and there was some data that suggested that getting a lower dose for the first shot was more effective than getting the full dose twice. So I'll leave it to people that are experts in that to advise on that. But yeah, I think the longer we have to develop these types of things, the better they're going to get. They will improve with time.
And the better knowledge. I mean, the more data, the better the outcome. So, but my understanding always with the Moderna in particular, and some people seem to have a reaction to that second shot, although I know some people who've had a reaction to the first, and it's not a terrible reaction, but it's not particularly comfortable. But the first shot wakes your immune system up, so when you get that second shot, your immune system's wide awake and goes to work. And I think sometimes that's, I always tell people that's also an indication of how vital, how robust your immune system is if you have those types of reactions.
That's
so,
right.
Do you expect the state to add more vaccination sites in Daviess County?
I think eventually they will. I know that one of the challenges right now is the supply of Pfizer is continuing to go up. Moderna has been pretty flat in terms of the number of doses that the state's receiving. In Johnson & Johnson, we got a big push a couple of weeks ago, and then it's been very small since then. That'll probably ramp up. So I think that when you see more supply with Johnson & Johnson, you'll see more providers, more sites in Daviess County. The challenge with Pfizer is it comes in 1,200 dose boxes, and it's hard to add a lot of different sites with that volume on each week. So you have to have.
Here's a question. First of all, I think I saw where Johnson & Johnson just signed a contract with Merck to manufacture for them, and that's going to ramp up. I mean, it's a function again of manufacturing capacity. So, how does how is our area doing compared to the rest of the Commonwealth? The first question on vaccines. In other words, tell me how the state divvies the vaccine up. That's probably the best question. How does Daviess County compare with Warren County or McLean County or McCracken County in the number of doses that they receive?
Yeah, so you're catching me cold here because I haven't calculated it in a couple of weeks, but I have checked on it at various times over the last couple of months, and we've always gotten at least our fair share if you do it proportionate to population. And honestly, I think that we're probably a little ahead of a lot of areas in the state right now. So in terms of what's been administered or what's been allocated to our region and to our county.
And in my conversation with Secretary Gray, the state really tries to do a good job to make sure that everyone gets their fair share. Now, that doesn't mean that Daviess County gets 100,000 doses. McLean County will get 100,000 doses. They will get their proportional share, which is their population is about 10% of ours, so they'll get 10,000 doses. Just using those numbers. So I think we are doing well. And the fact that we have a regional hospital in Owensboro Health was a big help initially as well. Indiana, I think the federal government actually sets up the way these things are distributed and divided. And I think Indiana is getting their share as well. I believe they've got about twice the population of Kentucky. I don't know, it may not be twice, it may be 1 2/3 times, but I think that's the only fair way to get it done. And real quick, another question that I had, do you know, talking about the state, have you had any indication as to when the next tier will open? Right now we're 1A, anybody in 1A, 1B, and 1C, and that's a huge number of people. Age wise, it's anyone 60 and below, but there are essential workers that fall in there. There are chronic health things that fall in there. So have you heard any information about when the state might open another tier up?
I think it's going to happen fast, is what I think. And like you said, 1C is a great big group, and there's thought put behind these priority groups. But the president has directed states to offer it to any adult by May 1st.
Right.
So that's not that far off. But I personally expect that Kentucky will get there quicker than that. Okay. I can't say exactly when, but I think it'll be in weeks.
Let's go back real quick, and I do have another question, and we're needing to close it down because I know you're busy. There has been some comment about those who are in our jails and our prisons and even in our recovery units about why aren't we going in there and just giving a wholesale vaccine to all of them if that's where all these kinds of things are happening. What's your thought on that?
Well, I mean, it is a high risk setting. And I think that, the problem has been up to this point is just that there's more demand than there is supply of vaccine. And, I think the other thing is that we've really wanted to focus on that over 60 population, because that's where 91% of our deaths have been in Kentucky. So, I think we are not far off from offering vaccine to inmates. And in fact, we're already offering it to those that are in those high risk groups. If we had enough vaccine, it would have happened already. But I think we're going to get there. I was on a call this morning, and the state's, going to be shipping vaccine to all the state penitentiaries in a couple of weeks. We've already started having some conversations with our jailers and looking at how we can assist with that.
I know. I think I had 165 cases of inmates at our local jail. So that's 165 out of a population of 650, and we had 22 employees, deputy jailers, and that's probably how. I don't know. We probably have 60 or so. I mean, we were fortunate. Again, I've told people how fortunate we were that Jailer Magdalene has done an excellent job keeping it out. But around Christmas, it got in, and it spreads. And of course, we were able to contain it. And then in January, again, it got in and it spread, but we were able to contain it again. So I know that those people who have loved ones in our jails and our prisons would like to know that they're being taken care of. I can tell you that not one prisoner in Daviess County Jail ended up in the hospital, and not one prisoner or employee died from COVID-19. So just a couple more. Here's one that's sounds more political than anything else. There are what I hear being called health passports. When we got a vaccinated, I got a little card from Owensboro Health and it showed where I got to two. I don't know. And the question is, do you have an opinion on health passports? Will that be a requirement for future travel and employment? Well, first of all, private employers, I don't think you can prevent them from doing anything. They could require, if you're going to work in my business, you're going to get your shot. Simple as that. We try not to mandate those things. I know here at Daviess County Fiscal Court, it's completely optional. It's up to you. We highly encourage that you do. It's the same thing with the flu shot. We highly encourage that you get the flu shot. But if you say, no, we're not going to, now we might put some restrictions. If you don't get it, then you're going to have to wear a mask. Right. You're going to have to work by yourself. You can't be around when everybody else is on break. You can't be in the same area with them. So what do you think? Do you think something like that will happen? Personally, I don't see it happening because I don't think the general public would put up with it. But there's nothing restricting private companies such as airlines and cruise ships and folks like that from putting those restrictions on people. I think we even had a state, didn't Hawaii say that you had to have proof of being COVID-free before they would allow you into Hawaii?
They are doing that now. You have to have a test within 48 hours before you fly. So, I think that there may be some limited use of that. I don't think it'll be widespread. I think if we get enough people in our society to get vaccinated, there's not going to be a need for it, for one thing. And I think that it probably would be more likely for like international travel, that you'll have certain countries that will require that as a condition of entering their borders. But domestically, I don't foresee that as being something that's going to be widely adopted.
Okay. Do you have time for two more questions?
I do. You've got me till 2:30.
All right. That's what I thought. I guess the one question is, at what point does the governor roll back his mask mandate? Now, that's asking you to look into the future, but at what point can we look at being able to go out into our community and not wear a mask? Or, as I have seen in other cities, as I've traveled in other countries that I've traveled, there are some people there that wear a mask regardless.
Right. So, I don't know exactly the timing on that. I think that, the way that'll look moving into the future will look much different than it has in last year. We were in a crisis, we were in an emergency. And that's why you had things like executive orders that required people to wear masks in public. Once we come out of this emergency, you're not going to have these type of emergency orders. So, again, it all hinges on us getting, absolute control over this. The vaccine rollout at this point is going very well in terms of its pace and the number of people getting vaccinated. If that continues on, that date will be here sooner than I expected 3 or 4 months ago. But it really all hinges on, can we get this done as a society? And can we get COVID to a place where it doesn't run the risk of overrunning our healthcare system or completely disrupting life like it has before? So I don't know exactly. We talked about that again with earlier when we were talking about can I have a wedding in the fall? Things are going to improve. Things are going to change. I just don't know exactly what they're going to look like and what that timetable is going to be. But yeah, I think there will be a day where they're not required to be worn in public. I think some people still will
I do too.
I think that's going to be one of the after effects of this. But I think that the way that we manage this will look much differently than it has while we've been in this crisis mode.
Okay, so last question is usual, I like to stir the pot somewhat. So I'm sure that I have folks on here that are watching who are naysayers that COVID really isn't as bad as the flu, that we have flu cases every year, that we have deaths from the flu every year. Quickly, and I may have a little advantage over you because I looked it up before we came on, but I think, Clay, I saw where the common everyday flu is almost non-existent this year during this, and the flu season goes from October to May. So, I mean, there have been negligible numbers of cases of the flu.
Yeah, that's correct. And there are several hypotheses as to why. Some folks have speculated that it's because of all the mask wearing that we do. And I think that's a good theory. It could be that COVID's out competing it. That could be a factor in it. But for whatever reason, and I guess we will eventually have that answer. But flu cases have been very low this year, and that's a fortunate thing. You may recall back in late summer, early fall, we had this huge concern about a twin pandemic, or a twin epidemic between flu and COVID-19, and very thankful that didn't materialize. So. We'll have to wait and see and figure out the exact reason behind it. But you are correct. There's been very little flu this year.
So the latest statistical evidence when this was, we've had about 30 million Americans infected with COVID, 529,000 deaths as a result of COVID. And whether you believe it or not, that's how they're being reported. The flu season, 2019, 2020, that was estimated at 38 million flu cases and 22,000 deaths. So that's about the same number of flu cases as COVID cases, but 20 times, almost 25 times as deadly. Mm-hmm. So, folks, that in and of itself ought to be reason for you to remember that when you go out, when you're not around with folks from your own household, you put your mask on, do what your mama told you when you were little, wash your hands and sanitize. You avoid large crowds and you socially distance. So with that, Clay, as always, appreciate you being here. Folks, I hope we answered all your questions. If we didn't and you've got any more, post them and I'll try to get an answer from Clay. Probably, I hope I only get to see you maybe one more time and then I'll be shed of you for a while.
Well, I'm sure we'll cross paths somewhere.
All right.
All right.
Clay, thank you very much. And for all those out there who have been listening and watching and submitting questions, thank you for joining us and look forward to seeing you next week.